can happily confirm that various types of physical activity is beneficial for mental health, not just walking or running, but also your resistance training, your yoga, your Tai Chi, your dancing.
We have this concept called gym intimidation where people can feel very intimidated in a gym. And I think Fitness First ran a poll that I saw lately of people in the UK. And the number one reason they didn't go to the gym was because they were afraid of judgment of other people.
We know that the physical environment is really important for supporting physical activity. If you've got more access to safe walking tracks, for example, or open spaces, blue space, as you mentioned before, we know that people are more likely to be physically active.
It's really difficult to get someone to adhere to the 150 minutes a week of moderate activity. That's the national guideline when can barely get out of bed or can barely eat. Just getting them to go for a walk around their house, let alone the block, is hard enough in itself. So understanding where they're at, and like you said, that small doses make a big difference. Before we dive into today's episode of the Mental Wellbeing College, an important disclaimer. We do dive into the weeds of mental health, which means that at times we discuss sensitive topics like suicide, self-harm, and substance abuse. If hearing such discussion does bring up distress for you, please do seek the psychological and professional treatment that you need. The content covered in this episode is not intended as a substitute for professional mental health treatment. Dr. Megan Teychenne, welcome to the Mental Wellbeing College.
Thanks so much for having me.
Yeah, it's fantastic to have you on. We're going to be discussing all things exercise for mental health, and in particular, looking at how people can optimize some of the exercise variables to make it better for their mental health, which I think is going to be really practical and applicable. So looking forward to that. But before we get into any of that, Megan, can you walk us through some of the evidence for exercise for mental health? What kind of good things, outcomes can it actually change and help us with?
Yeah, sure. So, starting from the very top, we know about 1 billion people worldwide experience mental ill health. In Australia, it's about 20% of people experiencing mental ill health in their lifetime. And so that's why identifying strategies to prevent, treat mental ill health is really, really important. When it comes to physical activity, I think most people know that physical activity is good for mental health. But what the evidence has shown is that it's not just good for the prevention, but also the treatment of mental ill health. So a couple of years ago, there was a review of reviews that was published in the British Journal of Sports Medicine. And what they did is they looked at all the reviews that have been conducted that have assessed the effectiveness or efficacy of exercise interventions on different mental health outcomes. We're talking depression, anxiety, and psychological distress. There were over 1,000 randomized control trials that had been conducted looking at these outcomes. And what they found was that there was moderate evidence on improvements in depression, anxiety, as well as psychological distress from exercise interventions in adults. So really strong evidence there, which is great. When it comes to children's physical activity, we are seeing similar patterns. There's less evidence there, but certainly a strong evidence for reducing depression, as well as improvements in cognition. And there's a little bit of evidence suggesting that physical activity can improve anxiety symptoms in kids, but there's still a bit more research that needs to be done there. But I think also on the flip side, that's talking about treatment in terms of prevention. There's a lot of observational studies that have been conducted that have looked at whether physical activity at time point 1 predicts, reductions in depressive symptoms or anxiety symptoms at that time point 2. And again, really strong evidence to suggest that physical activity can prevent the onset of depression and anxiety. So our two very common mental health problems, which is really great news because physical activity, it's widely accessible. It's generally pretty cheap, if not free. And generally most people can do some form of physical activity. So a great tool for most people to use.
Yeah, fantastic. And I love what you mentioned as well about the accessibility of exercise, because that isn't the case for some of our other wonderful evidence-based treatments, right? Like therapy can be expensive for some people and can be out of reach if there's a big wait list for your local psychologist, and medication, again, great evidence and effectiveness in some cases as well, but obviously side effects. But when you look at the side effects of exercise, it's pretty good, pretty positive side effects, huh?
Yeah, and I think also one thing that exercise doesn't have is stigma, right? And I think certain population groups out there that may be still a little bit, worried to disclose that they are experiencing a mental health condition. Again, looking at the stats, they are absolutely not alone. So by having these, exercise interventions for mental health, we're able to capture a wider subset of the population to improve their mental health.
Yeah. And you mentioned as well, Megan, something about treating depressive symptoms and anxiety symptoms. So one distinction I think it's important to make and put to you and ask is exercise, does it demonstrate evidence for treating people with major depressive disorders and anxiety disorders? Or is it people, let's say for myself, I don't meet the criteria for an anxiety disorder, but I do at times have anxiety, like when I was dealing with that spider last night that I was telling you about. So can it help in subclinical and clinical instances, or is it more one or the other?
Yeah, absolutely. There is actually a really large body of evidence now to suggest that exercise is beneficial for improving mental health for people who are already experiencing clinical depression or clinical anxiety. But there is also that large body of evidence to show, and probably a larger body of evidence to show that it can improve the symptoms of depression, anxiety, even in people who don't experience that clinical diagnosis.
Yeah, wow. Okay, so very powerful tool, even that practitioners could be using when they're sitting down in front of someone who is facing a major depressive disorder or an anxiety disorder as such, which is really cool to know. Do you see, or do you have your finger on the pulse as to if people are using this in practice, practitioners, or what that kind of looks like, whether it's doctors, GPs, exercise physiologists, psychologists? What's your kind of take on that?
Yeah, look, I think there's a lot of interest in the field, and certainly exercise physiologists are one form of health practitioner that do use physical activity to improve mental health. A lot of GPs are aware of the benefits of physical activity for mental health. But I think the problem lies in potentially the training and disseminating that broader understanding of how we can really optimize physical activity and mental health benefits. And so we've been working on, providing guidance along what kind of physical activity is going to enhance those mental health benefits. And this has been a piece of work that's been led by Stu Vella at the Uni of Wollongong, really exploring the contextual factors of physical activity for mental health.
Yeah, which is a really, really interesting paper, which I'll link in the show notes. And I definitely want to dive into that in full detail, because that's really insightful, some of the findings that you guys had and canvassed in that paper. But one other particular area of efficacy, which has demonstrated, exercise has demonstrated good benefits that you've covered, is in the perinatal period. So particularly in things like postnatal depression. Can you talk us through some of the effectiveness of exercise in these instances?
Yeah, sure. So your listeners might not be aware of postnatal depression. So just to give a little bit of a background there. So this is depression that's experienced by mums and also dads now too. There's a body of research now looking at that. But in the first year of childbirth, after having a baby, we know in Australia about 1 in 5 mums will experience postnatal depression. And the causes are multifactorial. So you've got biological factors, hormones, we've got psychosocial factors as well. It might be a lack of social support. And there's also behavioural factors. So physical inactivity, poor quality diet, and poor quality sleep. And unfortunately, these behaviours generally fall off the wagon a bit when mums have babies, which is fair enough, because their focus is trying to keep a tiny little human alive. And unfortunately, mums' priorities generally jump down the line. So we've been looking at the link between physical activity and postnatal depression.
Mm-hmm.
And what we've been able to show is that, yes, physical activity is beneficial in prevention and also treatment of postnatal depression. There's less evidence out there compared to the broader population, but enough that is convincing to suggest that we need to be developing interventions and programs to support mums in this stage of life to enhance their physical activity for mental health. So that's what we've been working on, actually. So we've been developing a home-based multi-behavioural intervention, which targets food, move and sleep, or nutrition, physical activity and sleep, to improve mental health amongst mums who are experiencing heightened postnatal depressive symptoms. And we made this program home-based because we know that new mums, they often really struggle to get out of the house. They're working around their baby's sleeping and feeding routines. They might not have childcare. And so it's often a real barrier to step out of the house. So if we can provide them with some home-based support to help, kickstart those healthy behaviours again, it's likely going to be quite acceptable and feasible. And that's essentially what the mums have suggested to us in our pilot work, that they really appreciate that flexibility of a home-based program. So we're currently recruiting. So if your listeners, if they know any new mums living in Victoria, South Australia or New South Wales, we've got about a month left of recruitment. Tell them to come and talk to me. Yeah.
Okay. Excellent. Is this the Mums on the Move trial? Is that what you're referring to?
It builds upon that. So this is the food, move, sleep, or FOMOs for postnatal mental health. Right. And I came up with FOMOs because as a new mum, I had a lot of FOMO, So certainly builds on the Mums on the Move work, where we provide some exercise equipment to mums in the home, but also provides with additional supports such as a website and some SMS prompts, as well as an Instagram page.
Cool. Okay. Yep. We'll definitely have to get a link and pop that one in if people do want to find out more about that particular trial, because that does sound like very exciting work. And I mean that because I'm curious to know what the receptivity of exercise in the perinatal, particularly the postnatal period, is from mums, because just anecdotally from people around me, I had a friend, for example, who she recently gave birth and she exercised a lot during the pregnancy period. She's a doctor herself, and that decision to exercise a lot there was met with a lot of cynicism and a lot of doubt from people around her that you shouldn't be doing it. And there seems to be this perception that once pregnancy hits, exercise should all stop. But obviously your work is quite different to that.
Well, absolutely. The guidelines still are that women, whether they're pregnant or whether they're in the postnatal period, that they should still be engaging in physical activity. Our general guidelines are still 150 minutes of moderate to vigorous physical activity, so that brisk walking pace. But I guess in the postnatal period, it's about resuming in a safe way, listening to your body, even seeing a pelvic floor specialist, physiotherapist to get the AOK or your GP. That generally comes at about the 6-week visit to get the AOK to be resuming. But certainly starting off with light walks is a really healthy way for a mum to, regain not just their mental health, but also physical health and building strength. And you need a lot of strength as a new mum.
Do you find that participants who sign up are skeptical as well about doing exercise, after giving birth, or is that a bit of a sampling bias? They're coming to you because they're obviously interested in exercise.
Look, I think I'd love to say that we didn't have sampling bias, but I think in most exercise trials, there's going to be a bit of sampling bias in terms of who's interested and who believes that this potentially might work. But yeah, we provide a lot of information on how to safely resume exercise in the website as well as in Instagram. And so our mums are generally really well supported to be resuming as soon as they hit the intervention.
Yeah.
And we're recruiting women who have just got past the 8-week mark. So they're 2 months after having bubs or past that, which means they've generally got the AOK from their doctor in terms of healing from a C-section as well. That can often take at least 6 weeks to heal. So I guess following those kinds of guidance from systems that are already in place.
So when you say that there's some preliminary evidence for exercise in the postnatal depression, what kind of changes do we see in women going through this when they do exercise? What opens up for them on a daily sense, on a mood sense, on a psychological sense, having, now exercise? What changes for them there?
Yeah, so I guess improvements in, reductions in depressive symptoms and anxiety symptoms, but I guess also providing energy, high levels of energy. We know mums are often sleep deprived, but our pilot work with Mums on the Move, as you mentioned before, we had a lot of mums saying that they just felt like they had more energy, that they felt calmer through the day and in a little bit more control, because baby's going to throw anything at you, and you do have to remain calm and in control. And so if exercise can provide that sense of, calmness and relief for new mums, then I think that's going to be good for everyone.
Yeah. I can only imagine what that's like, not having children myself, but yeah, that certainly seems to be something with a lot of potential there during a difficult time. Yeah. So really cool work that you're doing there, Megan. But I do want to double click it and spend a lot of time on these wonderful papers that you've done on qualitative guidelines for optimizing the mental health benefit of exercise. So when we say qualitative, we're looking at, often we think of exercise in terms of how much, how long should each session be, 15, 30, 60 minutes, but your focus has been more on the environment, the context with which you do exercise, the type of exercise, some more of those qualitative rather than quantitative variables. There's a lot to go through here, but let's start with the type if we can, Megan. In fact, you know what? No, let's go further back. What motivated you? I'm very curious from a research perspective. What actually motivated you to look into this and do this work? Because most of it is on the quantitative variables.
Yeah, look, I guess it started with a paper that I published in 2020 about, do we need physical activity guidelines for mental health? This was really a passion project. It had been in my head for a long time, and conducting research in the field. I was particularly interested in the domain of physical activity. So, whether it be leisure time, transport, work-related physical activity or domestic physical activity. I can talk more about that in a moment. How particular domains may be more useful for providing mental health benefits than others. So after publishing that work, and that received a fair bit of media attention, we then got together with Stu Bella. I think I mentioned, did I mention before? Anyway, Stu Bella, you're wrong, that's the one, who has led the consensus statement on the qualitative factors that may influence or enhance our mental health benefits, which has been great. It's been a really great team to work with, researchers from across universities in Australia. And I think we each came to the table with, a particular contextual factor that we were really interested in. And so, happy to work through each of those if you like.
Yeah, let's do it. Well, why don't we start with domain then, since that's a big area of yours. Was that the one that you brought to the table that you were passionate about the most?
Sure was. Yeah, so for probably about 15 years, I've been looking at the association between different domains of physical activity and mental health. So some of my really early work, we looked at whether transport-related physical activity, leisure time physical activity, domestic or household physical activity, as well as work-related physical activity were associated with depressive symptoms. And what we found was that this was in about 4,500 women, I think the first study we did. What we found was that leisure time physical activity and transport-related physical activity were strongly associated with a reduction in depressive symptoms. But we did not see the same associations with domestic and work-related physical activity. In this instance, we saw no association. So it gave us a little bit of an understanding that it's not a one-size-fits-all, that there may be domains of physical activity, transport and leisure time that may potentially be more beneficial for mental health. And then some years later, Rhiannon White from Western Sydney then conducted a meta-analysis, and she looked at just under 100 studies that have been published, investigating exactly that, the different domains of physical activity, mental health outcomes, and was able to confirm essentially what we found in our early work, that transport and leisure time physical activity were strongly associated with better mental health. Interestingly, there was a adverse association between work-related physical activity and mental health, suggesting that potentially work-related physical activity may actually not be as great for mental health as the other domains. And then in terms of domestic physical activity, there was no association. But this kind of makes sense because you think about transport and leisure time physical activity. They're generally activities that we choose to do. So we've got autonomy over them. We also generally enjoy them, whether it's, a nice walk outside, a bike ride, whether it's dancing in the lounge room, whatever it might be. But in the instance of cleaning the house, admittedly, some people like to do that. But also work-related physical activity, where you might be a nurse spending 20,000 steps a day walking up and down the hospital. That kind of physical activity is probably not going to bring you those same elements of enjoyment and autonomy that you can gain from leisure time and transport physical activity.
Yeah, this is so important, right? This distinction between domains and indeed all of the qualitative variables that we'll go through. Because when we look at it more from like a physical health perspective, there's not really this level of, characteristics looking at it, distilling upon the different variables. It's more, well, if you get your steps in, you get your steps in and you've hit your goal and you're getting that physical benefit. Whereas the mental health benefit, and this is the point of your work and that paper indeed, is that we need to look beyond just those quantitative variables at the context, at the domain it's happening, because that will change not just how much you'll benefit from mental health, but as you're pointing out, whether you'll benefit on a mental health capacity.
Yep, absolutely. Spot on.
Yeah. Hello, everyone. A quick break from today's episode. At the Mental Wellbeing College, we are committed to the goal of communicating evidence-based wellbeing strategies out to the broader community. The goal of this podcast is to bridge a gap between self-help material and peer-reviewed research by providing evidence-based discussion that respects the nuances of psychology, but is digestible for all audiences. Ultimately, I hope that you as a listener feel empowered after each episode so that you can take away and implement strategies to improve your own mental well-being. If you have gained value from this episode of the Mental Wellbeing College, I would be so grateful if you were to hit subscribe or follow, or to share this episode with someone that you love. This is how we continue to grow the show, get the message out, and to impact people in need by providing such information and strategies. Thanks so much for tuning in. It means a lot to us here at the Mental Wellbeing College. And now back to today's episode. So, okay, we've got domain. And when we talk about domain in terms of work and transport, this is a distinction I'm trying to work through myself. So if you're walking to work, let's say from your car, you park your car somewhere else and you kind of walk into your workplace, as some people often do, to try and get in more steps. Is that more the transport? Is that more the occupational or work related? Where does that fit in, just for people listening?
Yeah, we generally fit in new transport related physical activity. Physical activity is the physical activity that you are doing for the purpose of work. So if your purpose is you're a builder or a bricklayer carrying lots of bricks, that's the kind of physical activity you would see there. But for transport, those small incidental times where you might park your car 10 minutes away and walk the rest, which is a fabulous way to squeeze in a bit of physical activity in your day. Some people love to bookend their day by doing that. I think that's a great way to be able to unwind at the end of the day, have your 10 or 15 minute walk to the car. That is your transport-related physical activity.
Okay, perfect. Let's go then, Megan, to one of the big ones, the types. So what should it be? Aerobic? Should it be resistance? Should I be doing yoga? What's the best? What's the magic pill here for mental health in terms of type?
Yeah, so in the work that Stu and our team were working on, we looked at the different reviews that had published the different types of physical activity and their association with mental health. And I can happily confirm that various types of physical activity is beneficial for mental health. So not just walking or running, not just your aerobic exercise, but also your resistance training, your yoga, your Tai Chi, your dancing, which is really great news. And I think what is really key here is that it's not necessarily about prescribing a type of physical activity. It's about choosing a physical activity that you enjoy, because you're more likely to stick to it and you're more likely to get those mental health benefits if you enjoy that physical activity.
Yeah. One of your co-authors, Felipe Shook, came on and he said this quote which stuck with me, which is, the best exercise is the one that's done. And I think that really sums up what you're saying there about adherence and consistency. But it's in the physical health realm, I was a personal trainer for a number of years, and I found it to be very dogmatic, almost like a religion, people swearing this is the best for the physical health, the outcome, whatever it was, this type of strength training or this type of aerobic training for cardiovascular fitness. And it's good to hear that from, at least from a mental health perspective, it's almost, what's your flavor of ice cream? Kind of pick your poison. Anything goes, like you're saying, to get that mental health benefit. So that's positive to hear.
Absolutely.
In terms of the social context and the social environment, what's the importance of that, Megan, for the mental health benefit?
Yeah, so in our review, we were able to show that both individual physical activities as well as physical activities done with others in that social context has mental health benefits, which again is really good news for everybody, because it can come down to that personal preference. Look, there are some studies that have suggested that there may be additional benefits from exercising with other people. But we also need to consider the quality of those interactions. So if you're going for a walk with someone that you enjoy their company, fabulous. You're probably going to get some kind of mental health benefits. If you're doing exercise with a group of people that is not satisfying your needs, then potentially you're not going to get those mental health benefits. So it comes down to preference here. And I think I speak also from my own personal experience. For some people, their only time for solitude in the day, like a mum, is that half hour of exercise we manage to squeeze in, before the kids are away. So for me, exercising by myself is my preferred method. And I think that's where I'm going to gain my mental health benefits from the most. Some people prefer to go and play sport, for example, or go for a walk with others. So again, I think I'm banging on about this personal preference, but I think your listeners will understand where I'm going with this. Make sure that you consider that, or if you're prescribing exercise for somebody else, that you are considering what they would prefer to do in terms of the social context.
I'm very much like yourself. I literally drive further away and past gyms closer to me, so I go to the gyms where I don't know anyone in my local area, because I really love that time of solitude and just me with my podcast or my music and some weights, and that'll do me for the next hour. That's often the highlight of my day. So very glad to hear it's a personal preference in that sense. What about the broader social context, in the sense of, like, I'm thinking gyms here, for example. We have this concept called gym intimidation, where people can feel very intimidated in a gym. And I think Fitness First ran a poll that I saw lately of people in the UK, and the number one reason they didn't go to the gym was because they were afraid of judgment of other people. So this might even be at your local park, but I think often happens and is quite prevalent in a gym setting. Is there any research done, or what does the evidence say about the quality of that social context, the broader context, not just who you exercise with and talk to, but the environment you're in?
Yeah, well, we did some interviews with women some years ago who spoke about this and feeling self-conscious when they go to the gym. And that was one of the key barriers as to why they wouldn't go there, or they would prefer to have women's only places to exercise and that kind of thing. I think it's so important that people feel comfortable in the environment that they're exercising in, whether that be in a gym or whether that be outside, and they're not feeling threatened by, safety concerns, busy traffic, all of that kind of thing too. And so if the gym's not a place that you want to go, probably not going to get those mental health benefits that you could get by otherwise being in an environment that you prefer to be in. So I think that's really important to consider.
Yeah, it's a good point you bring up as well, right, about safety, because mental illness can propagate in lower socioeconomic areas, and they may not have access to safe outdoor spaces where they feel comfortable exercising at their local park, where they don't feel threatened physically.
Yeah, absolutely. In fact, we did run a study, I think it was about 2017, and we looked at whether transport-related physical activity predicted depressive symptoms and vice versa, whether depressive symptoms predicted transport-related physical activity. And this actually goes against exactly what I was saying earlier on. It was one of the very few studies that showed that potentially transport-related physical activity would lead to worse mental health outcomes. But when we looked at the people or participants in the study, they were all living in low socioeconomic areas. And we know those areas are generally characterised by poor aesthetics, grave concerns for their own safety, crime, high pollution rates. And so this is where the quality of the environment is so important. And I guess this leads into that next step of that contextual factors paper was the physical environment. So, we generally speaking, that whether we're indoor or outdoor, there's going to be mental health benefits from the physical activity that we do. There are some studies that do suggest that exercising in blue space, so in the water, whether it's swimming or canoeing, or green space out in nature at beautiful parks, it potentially may have greater mental health benefits compared to exercising indoors. But we need to consider that quality of the environment, because it's for somebody who lives in a socioeconomically disadvantaged neighbourhood where they've got the concerns for safety, crime, pollution, all of that. Where do we think their mental health benefits are going to be enhanced from their physical activity? Is it going to be indoors? Is it going to be outdoors? And that's probably going to come down again to their own personal preference, but that environment, that quality is something that we really need to consider.
The green space and blue space effect, so like you said, blue space being in water, green space being in greenery, nature, what's the quality like? How do you find this evidence? Is it a randomized controlled trial? Is it correlational? Because I'm just thinking, if people, blue space, like here in Sydney, people who live near the water generally are the higher socioeconomic areas, and therefore they're probably more likely to have higher mental health at baseline, at least given mental illness propagates in lower socioeconomic areas. Do we have actual experiments of this?
Yeah, I think you make such a great point there. People living in those more advantaged neighbourhoods are going to have greater access to these beautiful places to exercise. And so this really comes down to a system-wide approach here, doesn't it? That we need to be working with policymakers, with urban planners to really help enhance the quality of the neighbourhoods where people who may be of a lower socioeconomic position are living. In terms of trials, there's a little bit of evidence there, but I would say predominantly observational work.
Yeah, okay. That brings to mind what you're saying about this concept Stuart Biddle, who I'm sure you're familiar with, told me about, of choice architecture. And he gave an example of the piano stairs. I don't know if you've seen this. It's in Stockholm. I think they have it in Vancouver as well. But for listeners who haven't, I'd highly recommend just YouTube piano stairs. And it's your generic stairs up a subway or train station up to the main street. But instead of the generic stairs, now when you walk up them like on a piano, it makes a piano sound, and different steps correlate to different sounds or keys. I'm showing how much I know about music here, which is not much, but it's a really cool, novel way of getting people to move more. Are there other effective or even novel ways of the choice architecture on a policy level looking at changing physical activity in a local neighbourhood?
Look, there's things like nudging techniques, which is similar to what you were talking about then. And I have to say that was one of my favourite videos to play to my students in the first lecture on physical activity promotion, just so they could get an understanding of what we're talking about. But, we've seen signs placed, near the elevator in buildings saying, use the stairs, it's good for your heart, or whatever it might be. Generally what we see with these nudging techniques is they're useful when they're there, and then when they're taken away, behaviour just reverts back to baseline level. But we know that the physical environment is really important for supporting physical activity. If you've got more access to safe walking tracks, for example, or open spaces, blue space, as you mentioned before, we know that people are more likely to be physically active. So it's not just an individual. In fact, we need to be thinking more broadly that physical activity is a social and environmental as well as a policy level.
Yeah. Makes sense. Yeah. We've covered a lot of the barriers. I think all of them. Have we missed any, Megan?
Oh, there are many. But
what have we missed?
I think many ones.
Okay.
I guess, one other barrier which we should talk about is mental ill health. And I think people experiencing, for example, depression are less likely to be physically active. Sometimes they struggle to get out of the house. Sometimes they struggle to get out of bed. And so this is why the messaging around some physical activity is better than none is so important, because we know that low doses of physical activity, I'm talking going for a walk a couple of times a week, has mental health benefits. And so people who are experiencing, mental illness, they are the least likely to be physically active. If they are seeing messages that they need to be doing 3 hours of physical activity a week, they're probably not going to do it, or they're going to have a real sense of failure. I can't do that. And so this is where we, in our guidelines work, we were really trying to hammer home the point that we need to make sure our messaging speaks to the people that we're trying to get to. That some physical activity is better than none.
Yeah, love that. I mean, exactly what you're saying is what's motivated my PhD to train psychologists to use exercise in a safe way with the very people that they see, i.e. people often with severe mental illnesses like major depression. And you're right, it's really difficult to get someone to adhere to the 150 minutes a week of moderate activity. That's the national guideline, when they can barely get out of bed or can barely eat. Just getting them to go for a walk around their house, let alone the block, is hard enough in itself. So understanding where they're at, and like you said, that small doses make a big difference, I think is huge to changing behaviour.
Absolutely.
Yeah. What's the way forward in terms of training practitioners, just finally, in terms of, okay, we've got these qualitative variables. They're probably not taught and talked about as much as the quantitative variables. I can only imagine in like a medical school curricula, focus is more on how much, the duration, etc., or an exercise physiology curricula. I imagine it's the same. How do we train the current and future health practitioners to do exactly what we've talked about in the last 40 minutes and consider these really important variables? Are there theories? Are there frameworks? Are there approaches to doing so?
There's a lot of theories and there are a lot of frameworks. And if we had another 10 hours, I could jump into those.
Yeah.
But I think your point around really trying to upskill our practitioners is going to be key here. They're often the first point of call when somebody's experiencing mental ill health, whether they're going to see the GP, whether they're going to see a psychologist or a psychiatrist or an exercise physiologist. And, we've also got to remember that there is a Medicare rebate to go and see an exercise physiologist for a few sessions. And I think that's something people tend to forget. So increased training and upskilling that workforce, it's going to come from universities, but it's also going to come from providing professional development to people who are already in the workforce.
Yep.
I would say those 2 points will be really important to put to the table when it comes to physical activity and mental health promotion.
Yeah, nice. Yeah, the chronic disease management plan, I think it's called, for exercise physiologists. You can get up to 5 sessions rebated. I didn't even know that until very recently. But you can get up to 5 sessions to see an exercise physiologist for something like depression. So you're right, there are pathways that are untapped really to see health professionals.
Absolutely.
Yeah, one thing I'm looking at is actually how we can integrate exercise into psychotherapy and use it as an adjunct, because it's really interesting. A lot of the guidelines from the Royal Australian and New Zealand College of Psychiatrists, for example, actually recommend exercise use as a first-line intervention for depression, but we as mental health practitioners aren't trained on it at all. So I think 2 things that I really want to double-click on are training psychologists to use it in an integrated way in psychotherapy whilst remaining within scope of practice. But also, I don't think many psychologists even know what an exercise physiologist does or is, and how can you actually refer one of your clients when needed, when they have a comorbidity, to see these wonderfully trained practitioners who have a unique skill set. But, people don't know about their roles.
That's right. And in Australia, we call them an exercise physiologist. In other countries, they've got other names for them, or they don't even exist as a workforce. So there's still a lot to do, not just in Australia, but also globally when it comes to exercise practitioners and supporting mental health. Yeah.
No, I love it, Megan. We certainly could go on for another 10 hours, like you said, and discuss some of those theories and frameworks, but let's not, because I think we've covered a lot already. Is there anything finally that you wanted to add to listeners?
I don't think so. I mean, the key messages you'll always hear me talking about is that some physical activity is better than none, and also just think about the contextual factors of physical activity that may enhance your own mental health. And that's probably going to be different from the person next to you. And my contextual factors are going to enhance my mental health. Are going to be different from yours.
Yeah, love it. Great take-home message for everyone. Thanks so much for tuning in to today's episode of the Mental Wellbeing College. If you've made it this far, it means you've gleaned a ton of value from today's episode, or you've fallen asleep. I sincerely hope that it's the former, and if it is, I would be so grateful if you were to hit subscribe, follow, or to share this podcast with someone you care about. Our mission here at the Mental Wellbeing College is to provide a free and accessible resource for people to take action and implement to improve their own mental well-being. And you subscribing, following, and or sharing helps us to achieve that mission and to impact people in need. Thanks so much for tuning in. It means a lot. We'll see you next week on the Mental Wellbeing College.